It's a word that can be scary when it comes to our healthcare. It's a word that has touched all of our lives in one form or fashion, and it's cancer. And at Kohif Pharmacogenics, Kohif Tailor Health, today this is our live Q&A about how precision medicine can help those who are suffering and going through cancer and cancer treatments. Welcome back to another live Q&A where we have some formatted questions that you can see in the post description, but we're also looking for your questions that you have about precision medicine, whether it comes to cancer care or maybe you have questions about something else for your family. We're going to do those answers today with the one and only Dr. Kohif. It's great to see you again. Thank you so much for your time and talking to us about something that is so scary and that all of us have dealt with in one form or fashion through a family member or a loved one. We were just talking, before I even ask you the first question, we were just talking about this is why you got into medicine, was because of the way that cancer has affected your family.
Absolutely. Thank you for having me. It's always, great to have you here. And of course, when it comes to cancer, I mean, we know that it's something that a lot of people suffer from. And I myself, one of the reasons why I actually created Kohif Pharmacogenics was because I lost some people, some family members, some friends to cancer. We know now that especially when it comes to chemotherapy, a lot of those can be actually prevented using precision medicine. So I think this is very important to address to cancer people because we know they go through a lot of pain, and it's our goal to help them actually to recover and not just really to recover, but also to be able to lead a healthier life. So that's
even during treatment.
Yeah, absolutely. Yeah.
Which is so important. So you can see the questions that we're going to be going through in the post description. And of course, for more information, you can log on to kohifpharmacogenics.com. That website is right in the post description. We want you to know that a free 15-minute consultation is just one tap away right there inside the post description. Dr. Kohif, why is cancer treatment no longer a one-size-fits-all? And what does personalized oncology really mean for patients?
Sure. I mean, that's a very important question. So we know that people with cancer usually they're usually prescribed chemotherapy, and chemotherapy by itself causes a lot of problems. I mean, we literally or oncologists they usually prescribe medications that actually help patients to recover from chemotherapy. Just like we give them medications to treat other chemotherapy symptoms. So I mean, it has chemotherapy has a lot of severe side effects and adverse drug reactions, including myelosuppression, bone marrow suppression, and many other things, right? And the traditional way is you have a specific type of cancer. Usually, you are prescribed a certain regimen, which is usually chemotherapy, with sometimes it's adjuvant to other like surgery, radiation, and so on. But usually you're gonna have chemotherapy as part of the treatments, and you will have the chemotherapy cycles that we know, especially cancer patients are aware of. So traditionally, it's a given to you based on a trial and error, But when it comes to precision medicine, it takes into consideration your unique characteristics, such as genetics, for example, to guide what actually chemotherapy might work and what might cause side effects and adverse reactions. So, for example, I'll just give one example. There is one gene that, for example, we test people for here. It's called DPYD. The FDA now is requiring cancer patients to perform that genetic test for that gene before they prescribe certain chemotherapy regimens. Because if you have a specific copy or variant or a mutation within that gene, it actually makes you more prone to develop severe toxicities, at least 100 times more than other cancer patients who do not have those genetic copies. They're just one gene, right? So I mean, that's on the treatment management side. But then on the other prevention side, there are of course other tests we can perform to tell you if you're in risk to develop certain type of cancers early. So
wow,
it goes both ways.
Again, the preventative side. Using genetics to be able to prevent and then, of course, help in the midst of. It's a live Q&A with Dr. Kohif. If you have questions, you can leave them right now in the comments section, and we will answer those live. How can genetic differences affect how someone responds to chemotherapy or the targeted therapy?
Absolutely, yeah. So just let me simplify this, give an example. So there is a medication that's called fluorouracil, for example, and it's prescribed to almost all types of cancer. And that medication is usually metabolized by a gene in our body. It's called the DPYD gene. So depending on what type of genetic copies or variants that you do have, we can tell if you're going to develop toxicities to that medication or no. So we know cancer patients sometimes go through chemotherapy cycles. Some of them might respond well and recover, at least temporarily, but others would develop severe toxic effects. Low red blood cells, low white blood cells and things like that, which we call severe myelosuppression. So if you actually do have specific copy within that gene, that means that tells us, okay, you're more prone to develop toxicities, then you're not supposed to take that medication and take the other one. Or sometimes it will tell us this is the dose actually to reduce side effects and severe toxic effects as well. So this is just an example. So definitely genetics help a lot when it comes to tailoring chemotherapy. So.
And can let me make sure I say
pharmacogenomics,
pharmacogenomics, the PGX, can pharmacogenomics testing help reduce side effects, like all those side effects that people have from chemotherapy and from radiation?
Absolutely.
How can that help people?
Absolutely, yeah. So in this specific example, let's just say somebody, they are actually prescribed a certain chemotherapy. And then if you have deficiency in that specific gene that metabolizes, that medication or that chemotherapy, what's going to happen now is you're not going to be able to metabolize it. And as a result of that, it's going to build up in your system and cause more and much more severe toxic effects even from chemotherapy. So chemotherapy, inherently, it causes side effects, as we know. But imagine that you actually lack the enzymes or the genes that help you to get rid of chemotherapy. Now it's going to build up in your system, cause much more severe toxic effects.
Yeah.
So that's how pharmacogenomics definitely can help with. We look at your genes and we see if you have deficiency. We tell you, okay, then probably you need another alternative. You and your oncologist, of course, you need an alternative that is not metabolized by that gene, and so on.
Amazing. Yeah. We did get a live question in, and we're doing a live Q&A here, so feel free to ask your questions in the live chat as we are live. And of course, if you're watching this after the fact, when this is being posted, you can still leave your questions in the comments section, and we know that Cool FM Live and Dr. Kohif will be monitoring those as well. Did get a question from JJ and Monica saying, do you have experience with hypermobile Ehlers, Danlos, and POTS? Is what that says. Right there.
Yeah. Oh yeah, that's not cancer, but that's a genetic hypermobility. It's known hypermobility syndrome. But then to that question, there are two sides of it. The first side is the diagnostic side, and the other side is the prevention or the treatment management side, right? So on the prevention side, there are some genetic tests now where we can perform to tell us if you're in risk to have that hypermobile syndrome, the syndrome. But to be honest, we're not focusing on genetic tests that will just tell people you have something, and we'll stop there. We don't want to do that. We don't want to just stop there. We want to do a genetic test and then tell you what to do. So where there are actually actionable clinical recommendations for that. So this is the diagnostic side. On the prevention side, absolutely, because patients with this condition, which is again, that's probably not cancer, right? But
right.
But just to answer the question. They are prescribed a lot of medications, and definitely the pharmacogenomics cover a lot of these medications. For example, pain management, because these people deal with pain. So pain management medications, sometimes psychiatry. They take antipsych meds sometimes to be able to deal with pain and things like that. So we cover all of this with the pharmacogenomic test to tell you actually, what medication should work for you and what shouldn't work.
And that's why you can go to kohifpharmacogenomics.com, right in the post description, tap on that and get a free 15-minute consultation.
Yeah, and also, Jeff, in the free 15-minute consult, we will discuss all these different situations, either me or somebody else on the team, So all our team members are actually trained in genomic medicine, which is very rare.
Yeah.
We have actually, like, for example, Dr. Shah, we have Dr. Sorrell, and they're all trained in genomic medicine. So they will be able to discuss it with you, and based on your situation, of course, we will recommend which test.
Great. Thank you for that question. And again, if you have a question, please leave it in the comment section. John's monitoring it behind the camera and can toss it over to us. But our primary topic today is about cancer. And the next question that we have regarding cancer is, when is the best time for patients to consider precision testing? Would it be before starting treatment, or after experiencing the side effects, or both, or all of the above?
Definitely before. We're all about preemptive testing here. Definitely before you get cancer or you start on a treatment, you definitely want to. Because I want people to understand, and people probably know that when it comes to cancer, it's a very time sensitive, I would say, condition, because, you can't take medication and trial and error and then try for a couple of months, and then it's time sensitive. So we definitely recommend for people to do that preemptively before they even have cancer. This is for everyone, or at least if they know they have cancer, they need to do that before they are prescribed any chemotherapy regimen, because this is going to make a huge difference. And we see this actually. We have a lot of patients who perform the test preemptively, and then, just in case, God forbid, in case, But if you actually have cancer, you're diagnosed, you definitely will be put on some chemotherapy. So you definitely want to get that test done.
So. I had another live question coming in. It's a live Q&A here with Dr. Kohif. This is from Roberta. She says, I have AML, currently in remission, had many rounds of chemotherapy and gene testing. What can you offer me to determine if I'm at risk for my cancer to return or another cancer to form?
Okay,
that's
so
a great question,
that's a very AML. That's acute myelogenous leukemia, which is the type of blood cancers, and it's probably one of the most aggressive, unfortunately. But she stated that she did genetic tests. We want to know what genetic test, because again, a lot of those genetic tests usually are the ones that tell you that you do have the condition. But is it the one that tells you what to do and how to manage the condition?
Right.
So we deal more with that on the management side. So, for example, definitely a free 15-minute consult would be helpful for us to understand what genetic tests they performed, and we take it into consideration, of course. But there are two genetic tests we offer in place that can help with that a lot. The first one is the pharmacogenomics, which help us on the prevention side and medication management side, tells us what medication she should be on. And the other one is the nutrigenomics. Nutrition is very important. We'll come to this later.
Yes. Yep.
Nutrition also is very important, and to know what nutrition that actually you need. So we need to understand more about what, the situation, the hermetical history as well, and all the other factors, and also what genetic tests you should perform. But definitely we have people, I think, AML and many other type of blood type. Because when it comes to cancer, the chemotherapy selections are very limited. Usually people will be put on similar chemotherapy regimens all the time. Whether you have AML or you have any other type, it's going to fall within some medications that we know. So we definitely can help with that a lot.
Right. And that's the difference between the cookie cutter answers and then finding it through genetics and genetic testing, what could work best for you as a patient.
And also, we don't know what medication she tried as well. That's one thing we would look into as well. So, And we work with your oncologists. We don't claim we're not oncologists, right? We're precision medicine specialists who help people in all these different specialties, but definitely we work with the specialists all the time as well. So
a great reminder, again, if you are looking for answers about certain genomics questions or pharmacogenomics, this is the place. And KohifPharmagenics.com is in the post description. Just tap on that for your free 15-minute consultation. Moving on to our topic today, which is cancer with Dr. Kohif here at Kohif Tailor Health. How can understanding a patient's genetics help those oncologists end up choosing safer supportive medications, such as for nausea or pain or anxiety or the other secondary things that people deal with?
This is a very good question, And again, this is, I would say, one thing that's very, I think, unique when it comes to us, because we're all about comprehension. We're very comprehensive, and we take a holistic approach when it comes to precision medicine. So a lot of genetic tests, they just cover one or two genes that deal with chemotherapy. But no, we know that cancer patients, most of the time, they're also put on supplemental supportive medications for nausea, pain, even psychiatry sometimes, because, they go through pain. Our panel, we cover all these. So within our panel, you're not just getting the genetic insights for medications or chemotherapy only. You're also getting it for psychiatry, pain management, nausea. We cover all these genes within our panel. And this is something that our scientists develop, and we'll make sure that it covers all of these. And again, this is just one part, but then we'll combine it with using our wonderful AI agent in place. We combine it with all the other factors. Just remember that genetic it's a big piece of the puzzle, but there are still other pieces that we also take into consideration, like your medication profile, medical history, drug interactions, herbs, nutrition, and so on, right? But so supportive therapy is something we cover within our actually oncology panel. So this way, your oncologist, we will communicate with your oncologist the recommendations. It's also going to cover it for pain management. What is the best pain management is better to work for you. And if it's psychiatry, you're put on any antidepressant or something like that, because some cancer patients go through this. You can also receive guidance. Vomiting, nausea, all of these are covered. So,
using precision medicine, even in the midst of cancer, hopefully preventative, but at the same time, even if you were going through that right now, KohifPharmacogenics.com. In the post description, just tap on that for more information. And Dr. Kohif and his team will work with your oncologist, will work with your medical team to be able to help provide better answers for you. We talked about it already, brought it up twice. Let's talk about nutrition. What role does nutrition play during cancer treatment? And can genetics help personalize those dietary strategies?
That's very important. I mean, diet or nutrition is very important when it comes to cancer patients as well, because the nutrigenomic test that we offer, it covers nutrition and many other things, but not just nutrition really, but also it covers inflammation. Mm-hmm. And this is really important because inflammation, we know that is really connected to cancer, development, inflammation, and detoxification. So that's also covered in our nutrigenomics. So we will be able to actually guide nutrition for you, and not only nutrition, also other things that you might have deficiency in. If you have a problem in your detoxification or inflammation process in your body, we will tell you, and then we'll tell you what to do about it. Because again, also detoxification is very important because we know that cancer is acquired most of the time. It's something we acquire due to environmental exposure to certain things, or any other external factors, right? So detoxification is a process in our body which our cells try to protect itself on a daily basis, right? So if you have deficiency in detoxification, it actually might put you in risk to develop certain tumors and cancer as well. So it's very important. So this is something that's also covered within our NGX or nutrigenomics assessment or panel as well.
And that's just it. Can nutrigenomics help patients improve their energy, their inflammation control, and during recovery therapy?
Yeah, and energy when it comes to, cancer patients usually, I would say one of the main symptoms usually is feeling fatigued, and we get it, especially when they're on chemotherapy.
Right,
because chemotherapy is attacking everything in the body, right? So, and this is the goal again. So, the goal is we help on the management side, on the medication management side, and also we help on the wellness or the well-being side of things as well with the nutrigenomics, where we can tell you what diet is good for you to improve your energy and things like that, and to decrease your fatigue and so on. So it's on the supportive side and also on the medication management side as well.
And, Roberta brought this up. It is a live Q&A with Dr. Kohif here at Kohif Pharmacogenics, Kohif Tailor Health here in Sierra Vista, and serving the entire world through KohifPharmacogenics.com. In the post description, you are one tap away from a 15-minute free consultation. Roberta brought this up. Is there a role for genetic testing in long-term survivorship? And she made the point of preventing future complications.
Yeah, so preventing future complications it will be on the nutrigenomic side of things, because the insights, they're huge. The insights we provide using our NGX panel or nutrigenomic panel is something that's for lifetime, for cancer patients and non-cancer patients as well. Yeah. So, I mean, when it's to simplify it, it's literally telling you more about your body and then how to do things to avoid complications now and in the future as well. So definitely the nutrigenomics is going to help a lot with this. Even the PGX is going to help, because again, when we do PGX, it covers almost all the medications on the market. So even in the future, if you ever need a medication, So that's also help to prevent complications, things like severe side effects, and that might cause you to go through ER visits, hospitalizations, and many other things. So of course, that's also going to prevent those type of complications. So.
And if people are watching this right now who have an oncologist, how should they go about approaching their specific healthcare team if they're interested in integrating that precision medicine into their care?
Absolutely. Yeah, we do have oncologists already from different cities, and they refer patients to us. I mean, usually there are two ways. either to go to the oncologist to communicate with us, and we will be more than happy to schedule a meeting with them and walk them through our, the workflow and how we do things, and probably collaborating with them. Or the patients can talk to their physician about it, and then they can refer them to us, and or just go to the website, just get the free 15-minute consult, discuss things with you. And if you need your oncologist, you get their consent to attend with us. We're more than happy to do that. We do that all the time. So, yeah.
It's such a difficult thing for anyone to go through. And with the options being very cookie cutter, like you said, people can feel weighed down. They can feel overwhelmed. So as we wrap up this episode of a live Q&A with Dr. Kohif here, what would you say to a patient who feels overwhelmed, but definitely wants that more individualized approach to their cancer journey?
Yeah, what I would say is we feel cancer patient pain. We know it's something that I think is not easy to deal with. And again, it's just one of our missions as a company. And as a founder of the company, I know that cancer patients is one of our, I would say, top priority patients. We serve everybody, but cancer, psychiatry, and cardiology patients, they are the type of patients we take very seriously, and we're willing to do everything possible to help them. And so it's what I would say is that there is hope now, right? Because now we have tools that we never had in the past. And this is our job at Kohif Tailor Health, is to be able to deliver those tools and use this tool to deliver precision medicine that will help people, especially cancer patients, to take care of their cancer and symptoms and everything. But also one thing I want to say is we're working very hard to introduce some other type of test soon that probably will help even to get people away from chemotherapy.
Wow.
So there is something called targeted therapies or precision medicine target therapies. And the goal is, instead of using chemotherapy, the goal is actually to identify what genetic markers or genetic mutations or copies that are driving their cancer, and then target those specific genetic drivers with actually precision medicine therapies that are not chemotherapy. Literally now we do have some approved by FDA, and they're just like pills. Just think about that. You have cancer, and all you need to do is just take pills, just like you do for high blood pressure or an other condition. So you might not even need to go through any phase of chemotherapy at all.
Wow.
This is something we're going to be introducing as well to the community and everybody else.
So again, knowing that while oncology has had that kind of cookie cutter look, there are still people like yourself, there are still companies that are out there trying to find ways of dealing with cancer in a more modern way, I guess.
Yeah. I mean, sure. I mean, because we know that the biggest pain when it comes to cancer, it's not the cancer itself, it's the chemotherapy. The chemotherapy is attacking every single cell in your body, causing all these horrible side effects and toxic effects, right? So if we can get people to guide their chemotherapy selection, just taking the dose only needed and avoiding the non-necessary dosage or medication that are causing all these horrible effects, that's of course is going to help a lot. But also, if we can actually get people to stay completely away from chemotherapy and be put on medications or target therapies that are not going to cause a lot of side effects like chemotherapy, of course, that's going to help a lot. And that's our job again. That's our mission. So.
And that is a beautiful mission to have here at Kohif Pharmagenics, Kohif Tailor Health in Sierra Vista, serving the world through KohifPharmagenics.com. If you or someone you know are dealing with cancer, maybe you have a family member, please share this video, tag them in this video, let them see the hope that is available, the help that is available through genetics, through genetic testing, and exactly having that precision care combined with the care from their current oncologist, working together with them to provide the entire care for the entire patient.
Absolutely, and not just cancer patients.
Yes.
Within oncology as well, because God forbid, again, we don't wish anyone to go through cancer, but you never know, right? Also on the prevention side of things, we can help everybody, because our insights, again, for lifetime, they get you to know more about your body, how your body, detoxify things and inflammation, all these different parameters and markers in the body. So it's always good to know. And then also introducing other genetic tests that might tell us if you're in risk to develop cancer. So you don't have to actually have cancer to work with us. I mean, we do have a lot of people that come here like, I want to know,
Yeah.
And we appreciate that. And this is our priority, actually. We don't want this to be a reactive type of healthcare after the facts. No, We want to learn, get people to learn more about precision medicine, more about their body, more about their lifestyle, genetics, environment, exposure, all these wonderful things, right? And then help them to tailor care plan that is going to be for lifetime, right? So, yeah.
Proactive precision care
Yeah.
is waiting for you, is waiting for your family of all ages, people of all ages, who deal with different things. You mentioned the big three. You talked about oncology, cardiology, and psychology. So we've talked about
time, yeah.
Exactly. We talked about cardiology last
Yes,
time. We got oncology this time. We already know what the next one's going to be: psychology.
Psychiatry is going to be covered next time.
And with mental health issues that we all deal with and struggle with, knowing our genetics that can help us in tailoring that treatment that we need is something that's so important. And that is exactly why Dr. Kohif is here, and KohifPharmacogenics.com, Kohif Tailor Health, serving Southern Arizona and the world. For your free 15-minute consultation, make sure you tap in the post description, KohifPharmacogenics.com. And if you have questions, thank you to those who asked the questions today in the live comment section. We really appreciate that interaction here. That's all part of the education, having the education and providing that to you, the public who watches this and shares this with your friends and family.
Yeah. So one last time, one thing I want to say lastly, Jeff, is we want people to know that we're really doing this for the community and for people, because our mission is a change in healthcare, and it's not easy, right? So definitely we trust people. We know people are kind of fed up with the current healthcare system and how it is an insurance-centered healthcare. It's not really a quality-driven healthcare, and this is actually our mission. We're actually going against the current and getting out of way to actually help patients, because this is all about quality. So we want people to know that we're changing healthcare. No more one-size-fits-all care. No more insurance. We don't want insurance to tell us what to do. It should be what your body tells us what to do. It's what you tell us what to do, right? So your support is really appreciated, and it's been awesome now for at least 5 months. So
well, and we're so glad to have this opportunity to have a live Q&A with you, Dr. Kohif.
Sure.
Thank you so much for your time today. And again, if you're watching this and maybe you saw the cardiology episode that we talked about last time and seeing the oncology episode this time, and there's just more questions that you have, it's all one tap away right there in your post description. It's got KohifPharmacogenics.com, and you can schedule your free 15-minute consultation right from the device you're watching us on today. And if you have further questions, please leave those in the comment section. I know Dr. Kohif and the Cool FM Live team will be monitoring those, and we'll get those questions to him, or you can just send a direct message
call
the office, and he and the team will be able to address those with you. Dr. Kohif, it's always a pleasure. Thank you so much for your time today, sir, and happy Ramadan. And for everyone watching, thank you so much for watching. Thank you for sharing and again, caring about that proactive precision care that Kohif Tailor Health offers you and your entire family. For more information, click that link in the post description, KohifPharmacogenics.com. Stay safe, stay well, everybody, and find that precision, proactive care at Kohif Pharmacogenics. We'll check in with you again later on. Thank you so much.
Thank you.